Hi everyone, I wanted to come on here before this video started and let you know a couple of things before you watch. Number one, this video was filmed almost 2 years ago. Actually, it has been 2 years. So I have definitely changed since then. I've gotten my skin under control. I no longer have any filler or Botox just for the time being, but I just wanted to give a special shout out to Amanda Woodman, Dr. Barnes, the Cox Med Spa, and the Center for Plastic Surgery in Springfield, Missouri for doing this video with me and being so patient of the fact that I'm just now getting this up. Truth be told, I thought the files for this video were corrupt. They weren't going to work anymore, and so I wasn't able to edit on my computer, but I did some playing around, I did some research, and I can in fact edit the video, and that's why it's going up now. So I hope you guys enjoy this, and yeah, that's all I have to say. Bye. Good morning, guys. Welcome to my channel. I'm going to take you on a little journey with me today. It's something I've wanted to experiment with for a long time. So I'm getting injections and doing facial. So I'm really excited to see what that's going to look like. If you're uncomfortable with people getting injections in their face or you don't like needles, maybe just skip this video. Otherwise, please join me for some fun. Remember, it's just the equivalent of getting a haircut. These things are temporary. They grow out, they fade away. It's not that serious. I need to experiment a little bit. Oh, this is my first time ever getting any cosmetic work done, but I just got here to the medical spa, so I'm gonna go upstairs and get situated. Okay guys, I'm here with Miss Amanda. She has been doing this work for a long time now, and I trust her. She knows what she's doing.
Oh, fun today.
Yes, I'm so excited.
Yeah, so I'm an esthetician here at Cox, and I've been doing this for about 8 years. And when she asked me to do this, I was so excited. We're gonna do an awesome, fabulous treatment today. See some injections, so the whole works.
I'm so excited this is happening.
So my plan for Katie today, we're gonna do kind of an all-in-one extra special treatment. We're gonna do some dermaplaning, or she's gonna get a hydrofacial, and then we're gonna numb her, and we're gonna do some microneedling. Okay, so we just dermaplaned her, and then we're gonna put something on called New Peel. This is called a gommage, so you're gonna put it on. It's gonna go on like an oil, and we're gonna rub it, and you can kind of see on our face the rest of the skin balling up. It's a little bit messy, but this will make the skin just look like glass after. Yes. And then we're gonna start the hydrofacial.
Yay! Yeah, so I'm sure a lot of you guys are familiar with the dermaplaning. She basically just takes, is it like a little razor?
Like a little blade,
A little blade, and she goes over and gets rid of peach fuzz, dead skin cells. That's what it looks like. So I essentially will get rid of all of that to help the application of anything else she's going to do to my face just work better. So we are now moving on to the hydrofacial.
Yes, so the hydrofacial is a machine facial that uses super serums, do a lot of different things. So we change the tips, the suction, the pressure, the solutions. We can do chemical peels. So she's gonna get a signature hydrofacial, and this is just the exfoliation portion. We'll definitely show the extraction portion and when she's getting the peel, but we're just saturating the face, and then we'll do motions like this.
The first question I want to ask Amanda is, how do you determine like what work needs done on someone's face in terms of facials and procedures?
Yeah, so every patient obviously is different. I like to see and touch the skin first. Then we just go from there. We figure out what the concerns are. So let's say, breakouts, a little bit of pigment, fine lines. We'll just kind of go from there and see what we want to target first. I like to mix it up, so I kind of always use exercise as an example for skin. You can't just do the same thing all the time and get results.
That's so true.
So, I would say, okay, Katie, we have a few concerns here, so what do you want to target first? And then we'll just do physical exfoliation, chemical exfoliation for the choice of what chemical would work for you. I'll mix it up, do some lasers, do some microneedling. So I usually put my patients on a plan, and we'll just go step by step. We'll say this month we're doing this, Then the next month we're gonna switch it up and do this to target, you know, let's focus on pigment, let's focus on healing breakouts. So just really depends on person to person. I like to go month to month so that that patient's coming in, I see them, feel their skin every month, and we can, you know, see how their skincare regimen's working, how they're doing on their retinol. So yeah, in my long-winded answer, it just depends on what the skin looks like that day, how their products are working, and what we want to target.
Saying how the skin, you know, every time you come in, it's going to be something different. That also comes with aging and, like you said, what products you're using, because some products can destroy your face. And then, like me, I've been there. And, you know, as we age, there's, you know, different issues to address. So I think it is something that you do have to keep up on.
Yes, but we do like a plan, so.
Yes.
And we do like results.
Is it hyaluronic acid or what's in this?
This is glucosamine, red algae extract, and lactic acid. This is really softening the pores, giving you a nice glow. Then we'll do your chemical peel, and then we'll do some extractions.
Do you know what each ingredient in here, like what purpose it serves?
Yes. So each serum, you know, we choose specifically for a different purpose. And this one is kind of more of your, what we could do on each person.
More versatile.
But then if you do like a deluxe hydrofacial or something a little bit more specialized, we would choose, you know, what fit your skin specifically.
It feels very soft. What are we working with here?
This is just a clarifying mask. So this has like a mix of different like earth clays. Has a little bit of aloe in it, so it's not too drying. And we just did your chemical peel. We neutralized it, and now we're gonna let you set with this on the face. Take down redness, you know, help clarify pores, good for blackheads.
It's so nice. Do you typically use like, do you use this mask on a lot of people, or is it less
yes,
popular?
I like this mask. I use it on a lot of people. Because we're doing so much on you today, this one's a little bit less harsh than like just a pure sulfur mask. Which I would use on like acne patients or patients that are really red. So this one's a little bit more tolerable since we're gonna do so much exfoliation, physical and chemical.
And do you personally think that filler or Botox is for everyone, and why or why not?
Yes, I feel like it's for everybody. And you'll, you know, have to ask Dr. Barnes that too. I wouldn't say it's for everybody like age-wise, but I think, you know, once you're over 18 and you know, make your own decisions, obviously, and all that, it's great for preventative purposes. So I would say, you know, especially this year, early 20s, mid 20s, late 20s, everyone's been kind of focused on preventative care, and so that's kind of what we use Botox for here in our office.
Yeah.
You know, softening lines, but also preventative. But we do get a lot of younger patients getting it in through here, in through the nasolabial folds.
Yeah,
and obviously, you know, everybody wants plump lips.
Do you mind explaining? Because I feel like a lot of people mix up Botox and filler, like they think it's the same thing.
Yeah. So
what's the difference?
Botox from here up, so around the eyes and through here and through the middle of these 11s, and then kind of scattered up into the forehead to soften all that. Some people will use Botox in the chin to help with that cobbling a little bit. And our physicians don't love it, but sometimes above the upper lip for that lip flip. So then filler, like I said, for structure change is gonna be from here down. So, you know, in through the cheeks, in through the tear troughs, around the mouth here, around the nose, around the mouth, in the lips. You know, some people are into that jawline filler. We don't do a ton of that, but I'd say anywhere from here down, and anywhere, think about the hollowness, like your filler is wanting to fill something and plump something up. I think one thing people ask about all the time is like, if I get filler in my lips, are they going to be less dry? Because it's hyaluronic acid. And so, you know, that's something, yeah, that people ask about all the time. There is a lot of people that say that they feel like they are just because they're more plump and they have less lip lines. That's always something that people ask.
That's interesting.
Yeah.
If anyone comes to visit the southern Missouri area, they're located in Springfield. What do you think are some common misconceptions regarding filler and Botox that you want the general public to know?
I don't know. We have plastic surgeons here, and they're the ones that do the injectables, and you guys are going to meet Dr. Barnes. So I think one thing I just tell my patients is think about who's doing your injections, and you know, these guys, you know, pull up the face and see every muscle that's underneath there. They're not just a nurse injector that's just been trained on this. So I like to just warn people of, you know, people that talk about misconceptions and things, hey, let's think about who's doing your injection. This is your numbing cream. So this is a benzocaine, lidocaine, tetracaine numbing cream. We're gonna apply this all over the face, let it set for like 35-40 minutes, and then we'll start your microneedling. Microneedling is called a collagen induction therapy. So we're taking 14 little steel needles and the tip of a pen. We're using this on the face to create controlled microchannels or wounds all over the face. You know, so you'll hear it vibrate, and I'll be changing the depth of penetration all over the face. And so when we create those microchannels, those wounds, your skin goes in like, oh, I've been attacked, I've been wounded, I'm gonna go in and heal myself. And so in doing that, they're gonna build thicker, stronger cells, you know, therefore inducing collagen. It's great for texture, pore size, laxity. It does nothing for coloring and things like that. I guess, you know, that could argued that it can help break up pigment, but we usually do chemical exfoliation first as well. So we're using the microneedling for acne scarring, texture change, you know, fine lines. Yeah, and so it's an awesome treatment, and it's great because you can do it all year long. This isn't like a harsh chemical peel and you have 7 days of downtime or peeling and raw skin. This is 24 hours of you looking kind of blotchy and red and irritated, and then you can put makeup on and, you know, no one knows you had anything done. 2 weeks after or so, you kind of start to notice, oh, I look so like plump and smooth, and yeah, it's an awesome treatment. And we're treating on all levels. Like I said, physical, chemical exfoliation, and then now we're gonna induce collagen.
Who do you think is the best candidate to have this work done? Is it kind of for everyone, or would you heed caution with that? Or?
Yeah, so really your only contraindication for this is anybody who has any wound healing issues. Other than that, really anybody can get microneedling. Now if you're 18 and you have perfect skin, you know, I'm probably not going to do microneedling on you, but you know, anybody who has texture issues, who feels like they have really large pores, who feels like they're starting to, kind of their face is starting to sag a little bit, those are gonna be the people. Anybody who feels like their lines are really deep, you know, doing this and getting injections is gonna be great because you're just going at things from all levels. Like I said with the working out, it's just, you know, you gotta do a lot of different types of things to really actually impact the skin and make a difference.
Do you think like actually hydrating, like water, proper hydration, do you think that actually helps the moisture level of your skin?
Totally, yes. Okay. I totally agree with that. I mean, you can look at, see that, you know, you have tons of lines around your eyes, and, you know, that next day you drink a gallon of water and they look softer. Right. Also, you know, you're flushing toxins out of your body. So, you know, your skin's gonna thrive. Proper nutrients, lots of water, you know, hydrated. So totally, your skin nutrients and your body nutrients, your cells are going to break down. And when your cells are breaking down, you know, your collagen's breaking down, and then, you know, yeah, things can't thrive.
What do you think, Amanda? How do you think you can achieve incredible skin without breaking the bank? Is this possible to do?
Yes, definitely. I think that what happens is people spend $1 million on what they think is going to work, and it might not be the right thing for their skin. So instead of buying every single thing Sephora sells and ordering Curology and doing all that, just go to an esthetician and they're going to sell you an antioxidant, a retinol, and a sunscreen. And if you can, you know, you can run out of those things at different times, so you're not always purchasing, you know, those things at the same time. So I call those the money products. So if you can just spend your money on the money products, like if you need to skimp in a few areas, that's fine, but your face needs exfoliation, your face needs nutrients, and you need sunscreen. Yeah. And so that's what I do with my patients. You know, some patients can buy everything and some patients can't buy everything. And so you have to be good for that patient and tell them what is legitimately going to help them. And what's going to benefit them. And you say, hey, you know, if you can see me once every other month and you can buy these 2 products, like this is what's going to get you results.
How often do you think people need to be reapplying SPF in the summertime, or just when do people need to use sunscreen year round? Like,
Totally.
What do you recommend?
Sunscreen all the time for sure. Like summertime, definitely, like preferably like SPF 50 or higher. And then you want to make sure it protects from UVA and UVB rays. I don't really love chemical sunscreen, so I prefer like a physical sunscreen for myself. The problem with reapplying sunscreen, just like me, I'm a makeup lover. And so I put my sunscreen on, I put my makeup on, I'm ready for the day. But then what, I need to apply my sunscreen in 2 hours. I'm not messing up my makeup for, you know. So, you know, there's all kinds of things. Powder sunscreens, sunscreen setting sprays.
Yes.
Like, you know, the Skin Better Science, like tinted compact that you can just wipe over your makeup. Like, those things are essential for summer. So if you're gonna buy something for summer, that's what you need to buy.
Just make sure to comment if you have anything else that you want us to touch on. Okay, so now that we have let the numbing cream sit, we're gonna do the microneedling, and
we're just gonna put on a peptide gel to use as our glide, and then we're gonna choose our settings and go in an even pattern kind of all over the face.
It doesn't feel bad at all. I can tell there's needles, but maybe scale of 1 to 10, it's with pain level to 1 or 2.
A lot of people say it feels like a toothbrush kind of wiping across the face.
Yeah,
kind of like real scratchy.
That I'm excited to have corrected.
And you can see some little pinpoint bleeding, which is great. We want that. We want a lot of that, and kind of just let that in the skin. We want to see a lot of redness. We want to see pinpoint bleeding. That means we know we're getting to the right levels.
Good. Hi guys, okay, so I'm done with the facial work with Miss Amanda. She's now filming for me, so thank you very much. We have Dr. Barnes here. He's going to be doing my injections today. I'll ask him some questions as well and kind of let you guys see what's going on behind the scenes. And this is also a trigger warning. If you don't like needles, don't watch.
How was that? Not painful at all?
Scale 1 to 10 is probably like 2.
Okay, 2.
It wasn't bad.
Very good. Okay, raise your eyebrows up for me. Okay, relax. A couple more sticks on this side. What I try to do is I try to pinch the skin with my fingers here, and it kind of tricks the brain to think, wait, are you pinching me or are you sticking me? And it should take away some of that feeling from that sharp pain. Now, a lot of the misconceptions is Botox addictive? And it is not. It is not like nicotine, or it's not like narcotics or anything like that, but people can get addicted to the good look that they have, for sure.
Yeah. I was gonna say, I do have questions. I don't know if Amanda sent them to you or not. Yeah, I came up for you to answer on camera, so we'll get those pulled up in just a second.
So don't do those now.
Yeah, we will in just a second.
Okay.
My first question, have you seen an increase in aesthetic procedures since COVID, and if so, which ones?
You know, I think we've seen an increase in all aesthetic procedures. I think people have more time on their hands. I think they have a little bit more money that they've saved. So I think aesthetic procedures all around, or even elective procedures, I think we're seeing a definite increase in those, because people have some time, they're working at home, they can have the downtime, they can recover at home, and that's a much nicer thing for them. So I think we definitely are, for sure.
Yeah. Do you think filler / Botox is for everyone? Why or why not?
You know, filler or Botox doesn't have to be for everyone. You know, it's a completely elective procedure, an elective thing to have done. You know, if somebody wants to do something nice for themselves, they can totally do it. Now, it's not it for everyone. Not everybody has some fears of needles or injections, and then that's not for that person.
Right.
It is certainly suitable for each person, and it just depends on their desires and their wants.
Yeah.
That's the main thing.
How do you determine how much filler / Botox you inject in someone's face?
So that is most definitely 100% patient driven. Okay, I always ask a patient where they've had their Botox done before, how much they've had done before, and then I kind of gauge on if they were completely frozen the last time they had it and they had 50 units done. Then we say, okay, we're going to knock back your dose and we're going to see how that happens. Now, one dose, 1 unit, each spot, each time is not for everybody. You have to tailor it to their wants and their needs. So it's really patient driven regarding Botox, how much you should do or what their experiences have been with it. And I try to make that very personal with them instead of just, you have 24, you get 36.
Yeah,
okay?
yeah.
Now the same thing with filler. Everybody has a different look that they want to go for. That's for your lips, or that's around your nose, or around the chin. And you just have to have that private conversation with them to see what look are they going for. You know, do they want much fuller lip? Do they want a fuller upper lip? Do they want a fuller lower lip? Now I try to stick with the balances, okay, of having a 2-to-1 ratio of the upper lip and keeping it full and nothing bizarre or getting that duck lip face.
Yes.
You know, so, because, you know, you're walking out of the community, you know, now everything's covered with masks, but, you know, when you do take your mask off, I don't want somebody to be shocked by, oh my gosh, who is that?
Yeah.
Oh, that's bad, who did that? I'm not going back there.
Yeah.
So I want everybody that's walking out of the community to have a nice look.
What facial aesthetic procedures are you not willing to do that are popular right now, and why not?
So you'll see on all the TikTok videos, you'll see all the YouTube videos, you'll see plastic surgery offices that have all the new, latest and greatest machines, body type, face type, radio frequency. You know, our thing here at the Center for Plastic Surgery is that we want to make sure that things stand the test of time. So if something is still around when it was introduced 5 years ago, something was going right and it's working out. But what you see the trend is with each of these videos that you watch with a new machine or a new probe or a new needle thing, is that you don't see them 5 years later.
I didn't think about that.
That those procedures are phasing out because those offices aren't getting the results that they want to from us. So here at this office, we only have things or only do things that we know help our patients, or that they're going to spend money, then we want it to help them and they want them to have a good result.
Right.
As Dr. Price here says, no smoke and mirrors. There's a lot of all that stuff, especially camera angles and shadows and all that can create any image that you want.
Yeah.
Okay? Oh, that's awesome. Now I want up towards, I get towards more of the center of the lip. It can be a little more sensitive in that area, okay? Again, I try to pinch as I'm going, and then I only try to inject as I'm pulling out the needle in a retrograde kind of flow. Advancing up the lip here, as I've been to those areas that already have a little bit of lidocaine, a little bit of numbing medication. I kind of tap so I can feel that needle, feel where it's at, making sure it's in the right plane. Is that okay? Good job. What a little bit does here, it sharpens that filter column on this side in comparison to the other side.
Right. I think this is less painful than Botox.
And then as we march along here, we're just kind of going and following our path where we have a little bit of lidocaine to make this nice and comfortable for her. And again, injecting on my way out so I'm nice and safe. We don't get any intravascular injections, okay? Completely safe. Again, the center part of the lip up here at the Cupid's bow can be very sensitive sometimes. And people are different. See, she's already getting a really nice full upper lip, and we're going to match.
That's awesome.
We're going to match that lower lip with it. All right. Here's again these filter column injections here, just to get these to sharpen. Kind of distract the lip out here so I can really get the fullness out in the corner. And again, tracking right along that border, right underneath the vermilion. And again, injecting where I've been already. Keep it as painless as possible for her and injecting on my way out. So now, naturally, the lower lip has 2 small tubercles on the bottom of it. Hers are kind of right there and right there. They've gone down a little bit. We're going to kind of build those up a little bit. And how we do that, just right like this at this angle here. And I don't want to be too deep here because that vessel runs on the back side of the underside of the lip. So I want to be kind of right in the muscle here, right in the center of the lip, right where that tubercle is. And I'm kind of doing a retrograde flow. Right there, and you can kind of see that building up a little bit. Making sure my needle's deep. I'm not getting any filler too superficial. Okay. What I like to do with that one is kind of mold that a little bit. Keep that so that creates a tubercle on that side. I always tell them they will feel that little bit of filler in there where that tubercle is. To build up that mound, you have to kind of put a aliquot of filler right there, and they will feel that a little bit. They can massage that out if they don't like it. Now we've marched all the way across the top of the lip. We're going to come down this way now. We've kind of gone all of our borders. We filled our tubercles. When I'm looking at her, I'm still seeing kind of a 1-to-1 ratio. So I'm going to go out, I'm going to put some more into the lower lip, get that ratio a little bit better.
Mm-hmm.
Awesome. Just going to clean up a few marks. You can see she barely bruised at all. She's good. So she's got a nice border, a nice sharp, well-defined Cupid's bow now with nice filter columns on each side. Okay, nice rounded out upper lip. You can see we've got 2 shiny tubercles right there in the middle, a nice pout to the lower lip, and a full balanced lower lip in comparison to her top lip. She looks great.
They definitely look juicy. They look great.
Oh, they look so good. I could cry. What are the determining factors of how bad someone bruises?
Oh, you know, if somebody comes in and says they bleed easy, you know they're going to bruise. I mean, they know their history and how they're going to bruise. You know, sometimes you can look at their arms where they've kind of scraped themselves and cut themselves. If you see some bruises on their arms, you know they're kind of easy bruisers. If you know if you did their Botox and you're kind of holding pressure on each one of their sticks, you know they're definitely going to bruise around their lips for sure.
Good to know.
Okay, everybody's so different.
Yes,
Okay?
yes, for sure.
We're going to inject deep down here. We're going to go right on the piliform aperture, right next to the nose, and put an aliquot of filler there that actually will lift the cheek out, and it will blunt that shadowing of this fold right there. Just kind of like a stick. How was that? Did you feel that at all?
Barely.
Again, this is deep. I know that vessel going up to the nose is superficial, and I know I can put this down deep right along the bone without any problems or any risk. Okay, if you look at that, maybe you can see it on the video, how
Yeah,
that shadow has softened up right there and has filled out that side. Okay, very remarkable thing. Now, if she were to reach her tongue to the top of her mouth, she would feel that little aliquot there. Now that one goes down, but you do feel that a little bit, and you see that when you feel along there, you will feel that a little bit, and that will come down and mash a little bit, but there will be a little filler right there. Okay. Now, 2, 3 stick. Okay. I know I'm right on top of that periosteum of that bone. I know I'm kind of directing the needle where I'm just evenly distributing in the tissue so it gets vascularized tissue around it. And I'm watching that fold come up. Looks okay. I'm just gonna take a look. I always take a look to make sure everything's okay. And like I said, you'll feel that up there, okay?
Mm-hmm.
This side, don't feel too much, which is good. Okay. Let's see that. Looks good.
Yay! Thank you so much.
Okay, yeah.
Really a
That's fine.
fabulous woman.
That's fine. No eyes for your lips.
Thank you.
Okay.
Alright, thank you guys for watching. Again, thank you so much to Amanda Woodman, Dr. Barnes, the Center for Plastic Surgery, and the Cox Med Spa. You guys made me feel seriously like a queen that day. Yeah, I'm going to be showing some results. As you can see in the pictures, my skin looked so just flawless, airbrushed, beautiful. My filler, my Botox looked great. I really feel like this was the best that my face has ever looked. All I know is that after seeing this footage, I definitely need to rebook another appointment with you guys. Yeah, I am super thankful. Thank you again for watching. And if you have any questions for Dr. Barnes, for Amanda, for their place of work, please feel free to comment. I will also be linking their socials. So thank you again so much for your time if you made it all the way to the end of this video. I hope you have a great rest of your day, and I'll talk to you soon. Bye.